Might your dog or cat be getting better despite what they are given rather than because of it? Well, I've already discussed the placebo effect in animals, or more specifically caregiver placebo. And in this video, I want to discuss another simple concept we should all be aware of, known rather fancily as regression to the mean. Stay tuned. Hi, I'm Dr. Alex from ourpetshealth.com, helping you and your pet to live a healthier, happier life. And I believe that all pet owners should ask some fundamental questions about how they care for their dogs and cats, as well as how they treat them should they become unwell. Regression to the mean is a simple concept that can bring into doubt the fact that a particular treatment or a particular intervention helps cure or manage the illness it is proposed to help. You may have even seen a dramatic improvement in your pet that was not just wishful thinking or caregiver placebo. The improvement was real. So why then should you still question if a treatment works or not? Well, let me explain. Many diseases, especially chronic, long-standing diseases, wax and wane in their severity. They slowly get worse, reach a peak, and then slowly improve. If we take arthritic dogs as an example, or arthritic cats, then there will be periods when they seem to be relatively comfortable or at least less painful. Conversely, there will be times when they seem to be struggling or suffering from sudden, acute flare-ups and symptoms. The average level of pain they are in is called the mean. Now, knowing this, let's do a little thought experiment. Your pet is the arthritic dog or cat that we're just talking about. They're not yet on any treatment. So when do you think that you're more likely to take them to the vet or to start some other form of treatment and get advice from somewhere else? Well, I imagine the answer that you give would be that you'd seek advice when they were at their worst or thereabouts. When they are at their most painful is when an intervention is given. Now that might be starting them on an anti-inflammatory painkiller, it might be giving them a joint supplement like glucosamine or any number of other interventions. And what happens next is that their pain levels decrease, they are happier and more mobile, but did your intervention actually make any difference? Well, let's go back to the fluctuating symptoms of chronic disease. When our patients are at their worst, there is only one way their symptoms are going to go. They are going to return to the average or mean. They are going to improve to some degree, whether you do anything or not. Now, this regression to the mean is another reason why treatment studies should include both a treatment group and a placebo group. Both groups will have a tendency to get better as a result of regression to the mean. It is only by comparing the two groups, though, that the actual efficacy of the proposed treatment can truly be evaluated. So next time your dog or cat is feeling under the weather, or yourself for that matter, and you try the latest or greatest treatment or supplement out there, ask yourself if they're getting better because of you or in spite of you. So stay curious, ask questions, but at the same time listen to the evidence that is out there. And that's something that I'll discuss in my next Evidence Matters video in a couple of weeks. So until next time, remember to subscribe. And until then, I'm Dr. Alex from Our Pets Health, because they're family.